Welcome to ICD-10-PCS coding for Impella pump procedures. An Impella pump is a catheter-based pump providing ventricular assistance by augmenting or taking over the ventricle's ability to pump blood in patients with poor heart function. The inlet portion of the device pulls blood from the left ventricle and moves it through a tube and into the outlet portion that is in the ascending aorta. Impella pumps provide support during percutaneous coronary interventions, enabling access to procedures for patients who would otherwise not be suitable candidates for these interventions, or in patients in cardiogenic shock, allowing for adequate end organ perfusion and temporary ventricular function support to allow for adequate blood flow to vital organs while the heart rests and recuperates. Impella devices may only be used during the duration of another procedure, or may be inserted and removed during separate operative episodes. If you'd like more information regarding what the Abiomed Impella pumps are and how they work, please visit the URLs listed here. There are several types of Impella pumps, including these three common types. As illustrated here, the features of these devices vary across several characteristics, including the peak flow they can create, the site where they are inserted, their indication for usage, and their intended maximum usage time. For instance, the Impella CP is indicated for use during both protected percutaneous coronary intervention, or PCI, and for treatment of cardiogenic shock, with a maximum usage time of less than or equal to 6 hours for protected PCI and less than or equal to 4 days for cardiogenic shock, as compared to the Impella 5.5, which is indicated only for treatment of cardiogenic shock, but with a much longer maximum usage time of less than or equal to 14 days. This is an overview of the kinds of ICD-10-PCS codes related to the use of Impella pumps. Codes associated with the use of these devices include codes for insertion of both Impella pumps and graft conduits used to facilitate insertion of the Impella 5.5, a code for cardiac assistance, and codes for removal of these devices. The Impella 5.5 is inserted through either an axillary artery or the ascending aorta. Due to its size, a graft conduit is necessary for insertion. Axillary insertion is a minimally invasive technique where the graft conduit is inserted through an incision in the chest wall and then sewn or anastomosed to the wall of either, but more commonly, the right axillary artery. Then the device is advanced under imaging over a wire that has been placed through the conduit into the heart. The device travels through the conduit into the axillary artery, then into the ascending aorta, and across the aortic valve to the apex of the left ventricle. For insertion through the ascending aorta, a sternotomy exposes the aorta, and the conduit is anastomosed to the ascending aorta through an open chest. The device is advanced under imaging over a guide wire, through the conduit, and into the ascending aorta, then across the aortic valve to the apex of the left ventricle. For a demonstration of how Impella pumps are placed via axillary and ascending aortic conduits, visit the URL shown here. Insertion of the graft conduit to facilitate insertion of the Impella 5.5 is reported in addition to a code for insertion of the Impella device itself. Graft conduit insertion is reported from New Technology Code Table X2H, with the root operation insertion in the cardiovascular body system. In this table, the correct device value is F, conduit to short-term external heart assist system. There are body part values for the right and left axillary arteries and the ascending thoracic aorta. The only option for approach for this procedure is open. Note that this and the other ICD-10-PCS table illustrations throughout this presentation are summarized portions, not complete tables. Insertion of an Impella pump is reported with Medical and Surgical Code Table 02H, with the root operation insertion and the body system heart and great vessels. There are two heart assist device options in this table. The Impella pump is a short-term external heart assist system. Do not select device value Q, implantable heart assist system, to report insertion of Impella pumps. The two common approach options for codes for insertion of an Impella pump are 0 open and 3 percutaneous. Insertion of an Impella 5.5 through a surgical conduit placed in the ascending aorta is reported as an open approach because the chest is opened to expose the site of the procedure. If an Impella 5.5 is inserted via a conduit into the axillary artery, the approach is percutaneous because the device is inserted through the conduit, which acts as a passage through the skin to reach its destination in the artery. The Impella CP and RP are inserted directly into the axillary or femoral artery or femoral vein through the skin. So codes for insertion of these devices also use the approach value 3 percutaneous. There are 3 qualifier values available for codes to report Impella insertion. Qualifier J, intraoperative, is used for insertion of devices providing ventricular support only during performance of a percutaneous coronary intervention or other procedure, and then removed when the procedure ends. Qualifier S, biventricular, is used when 2 devices are used and 1 device is inserted into each ventricle. Qualifier Z, no qualifier, is assigned for insertion of a device into a single ventricle, not inserted solely for the purpose of intraoperative support. This qualifier makes no distinction between devices placed in the right or the left ventricle. A code for cardiac assistance is always assigned with insertion of an Impella device. The assistance is reported with a code from ICD-10-PCS Section 5, Extracorporeal or Systemic Assistance and Performance, with a root operation of assistance. The complete code for cardiac assistance in conjunction with Impella pump insertion is 5A0221D. Impella branded devices are only configured to provide continuous support. Therefore, 2 continuous is the correct value for the duration character. The correct qualifier value is D, impeller pump. For surgical encounters for Impella pump removal only, do not also report a code for cardiac assistance. Removal of Impella devices is reported with a code from Table 02P from the Medical and Surgical section for the heart and great vessels body system and the root operation removal. Removal codes are only assigned for removal of devices that were left in to provide continued ventricular assistance after a procedure was completed. Do not report removal for devices that were only used for intraoperative support. In these cases, removal is inherent in the placement. Do not assign a code for cardiac assistance with procedures for removal of the device only. The approach value for codes for Impella device removal is assigned based on the approach used. For example, an Impella 5.5 inserted via graft may be removed through an open approach, such as a sternotomy, or it may be removed through a closed chest. For closed chest removal, the graft is exposed, and then the device is withdrawn from the graft. The graft is then manually occluded, ligated, trimmed, and cleaned, and the residual graft is tucked into the subcutaneous tissue and the incision is closed. The video at the URL shown here provides a demonstration with explanation of this procedure. The qualifier value options are either S biventricular, which is used when devices providing post-procedural support are removed from both ventricles, or Z no qualifier, which is assigned when an Impella pump used for post-procedural support is removed from a single ventricle. There is no qualifier for intraoperative because removal of devices used for intraoperative support alone is not reported separately. Extracorporeal membrane oxygenation, or ECMO, performed in conjunction with Impella ventricular assistance is separately reportable, regardless of whether the ECMO was performed via central cannulation, peripheral veno-arterial cannulation, or peripheral veno-venous cannulation. Additionally, diagnostic heart catheterization and coronary angiography in conjunction with Impella ventricular assistance are separately reportable with codes from the measurement and monitoring and imaging sections of ICD-10-PCS. Facilities that receive patients with an Impella pump already in place may code for removal of the device only. A code for cardiac assistance is only reported when initial insertion occurs. This direction is based on advice in AHA coding clinic. Check with your organization's coding policy or individual payers for any exceptions to this guidance. Repositioning of an Impella device meets the definition of the root operation revision. Repositioning is reported with code 02W-AXRZ, revision of short-term external heart assist system in heart external approach. Assignment of a code for repositioning is not affected by the setting in which the procedure is performed, such as in the OR or at the patient's bedside. If an Impella device that has been used intraoperatively is left in place after the procedure has been completed and then removed a few hours later, codes are reported for insertion, assistance, and removal. When devices are inserted biventricularly for support during a procedure, but one component is only used intraoperatively and is then removed, while the other remains after the procedure has been completed and is removed later, 3 codes are reported. A code for insertion, with qualifier S for biventricular, the code for cardiac assistance, and a code for removal. The qualifier value for removal of the component that was left in after the procedure is Z no qualifier. Qualifier value J, intraoperative, is not appropriate because this portion of the device was not used for just intraoperative support. And value S, biventricular, is not correct because it was only a single ventricular component that remained and was removed later after the completion of the procedure. If an Impella pump is inserted for support during a ventricular tachycardia ablation procedure, insertion of the Impella pump is reported in addition to the ablation code. Thanks for watching. Health Information Associates is committed to providing educational products that help coders be their best. So be sure to check out the other presentations on the HIA YouTube channel, as well as our full catalog of offerings at hialearn.com. Happy coding!